My name is Barbara Thompson. I'd like to welcome you to the third annual Interprofessional Education event on the theme of scleroderma, and we're very happy to have you here this evening. It's going to be a very full evening. Firstly, I'd like to introduce an occupational therapy student who's part of a research team doing research on this interprofessional event. And I'd like to have her say a few words about what she's doing and what her team is doing.
Hi everyone, my name is Heather Hay. I'm in the OT graduate program. Myself, Nadine Lafreniere, and Caitlin Cook are doing research on interprofessional education. Just to clarify some things, as I know some things were confusing, the surveys that you received at the door, students, are what you should be filling out. So the surveys that you received at the door, you should be filling out. If you did not take the survey and you were told about the email, your email needs to go on the list that's on the folder on the table. We are really encouraging all participation from all disciplines, as well as facilitators, patient, and student. We're really hoping to benefit the future of interprofessional education and healthcare teams, so as much participation as we can get is well appreciated. If you have any questions, find me or the other two throughout the night. And thank you, Scleroderma Foundation and IPE Committee, for letting us do this. Thank you.
So just to reiterate what Heather spoke about, we're trying to collect data on the IPE programs, both from your point of view as students. We'll also be collecting data from the patient perspective to try and make this a better event going forward. And also we're hoping to use any data that we obtain to help support grant funding for future educational events in collaboration with the Scleroderma Foundation. Now I'd like to have a couple of our dietetic interns tell you about the lovely buffet that they have prepared for us this evening.
Hi everyone, I'm Katie Walczyk and this is Michelle Walker. And today we want to thank you all for coming to this IPE conference. And we want to thank you for allowing us to do our food service management theme meal here. We have plentiful options for everyone. Everything is gluten-free and dairy-free. We have low FODMAP options, and we have vegan and vegetarian options as well. Our entire menu was designed with scleroderma patients in mind, so we hope that you all enjoy.
Now I'd like to introduce Peter Mena. You're on. Who's a board member for the Steffens Scleroderma Research Foundation. I'd like to give him an opportunity to speak with you about their important work.
As Barbara mentioned, I'm a member of the board of directors of the Steffens Scleroderma Research Foundation, which is located in the Capital District. I'm joined here tonight by my wife, Linda, definitely my better half, and she is a fellow director. And also here tonight are 7 other members of the Steffens Board of Directors. That's how important this event is for our foundation. As a foundation, we have 3 primary goals: promote research towards the treatment and cure of scleroderma, Dagos, and related disorders, promote awareness and understanding of these disorders, especially among healthcare professionals. And lastly, encourage collaboration both nationally and internationally towards the achievement of the above goals. Our foundation recognizes the importance of interprofessional education and the necessity of cross-discipline teams for early diagnosis and ongoing treatment of scleroderma. Quicker diagnosis is especially critical for rare diseases such as scleroderma. From my own personal research experience at GE's Global Research Center, locally here in Niskayuna, I must emphasize the importance of cross-discipline teams to develop the best solutions. As examples of such collaboration in the medical field, and I was there at the research center when these two developments happened, the creation of GE's first CT, computerized tomography, and MRI, magnetic resonance imaging scanners at GE's research center here in Niskayuna involved a team of physicists, electrical engineers, mathematicians, computer scientists, mechanical engineers, chemists, and physicians. Tonight, we have about 200 students in occupational therapy, nutrition, nursing, pharmacy, physical therapy, and psychology, and 30 scleroderma patients and an expert panel. As I've said previously at the other two IPE events, this is simply fantastic. We are filming this event so we can share best practices in IPE and awareness with other nationwide scleroderma organizations. The Steffens Foundation extends our gratitude to all the organizations, including the Sage College's Health Sciences, the Albany School of Pharmacy and Health Sciences, and the Albany Medical College Patient Simulation, as well as all the professionals, patients, and students involved in making this scleroderma awareness event a reality. It's truly a team effort, and we sincerely thank you.
And now I'd like to introduce Dr. Lee Shapiro, who is a rheumatologist, a leading expert on scleroderma, and a physician with Community Care Physicians, and he's going to speak to us about the importance of interprofessional collaboration.
Thank you so much for all being here. It's so appropriate that it's in a gym, which is a place where teams play together and have a common opponent. And our opponent is formidable. Scleroderma is a disease we don't recognize quickly enough, nor one for which we do enough. Because it can alter appearance, cause pain and stiffness, limit hand function, create difficulty ingesting, digesting, and enjoying food, cause cough and shortness of breath, and because it is lifelong, presently incurable, and sometimes life-shortening, it can be terrifying, depressing, isolating, and disabling. Much of the terror comes from feeling alone, wondering what will come next, not knowing where to find answers, and wondering if answers even exist. But the path never needs to be so solitary or so dark. Our mission is to make sure you as healthcare providers know of scleroderma, know of it so that no patient is greeted with a blank stare when meeting you and mentioning their diagnosis. Instead, maybe you will be the first one to recognize its features and the first to suggest the diagnosis. My secretary twice recognized the presence of scleroderma in individuals who did not know they had the disease. For the physical findings can be so striking and so specific that lab tests are sometimes hardly needed. Hand therapists may diagnose individuals referred for treatment of carpal tunnel syndrome or rheumatoid arthritis. Pharmacists may suspect the diagnosis in those individuals requiring prescriptions for relief of both Raynaud's and reflux. Early diagnosis makes a difference, for it may save hand and lung function and prevent other disease complications, as well as sparing the involved individual months of confusion and anxiety. As new treatments emerge, they will always work best and be most important in individuals with early disease rather than disease of long duration. Each of you may have the opportunity to contribute to diagnosis and to shorten the long journey to an answer. For now, we don't have pills, injections, or infusions that cure the disease, though the treatments we do have may ease symptoms, slow progression, and lengthen life. Until we have a cure, we need your help, not only to speed diagnosis, but to use your skills to make life easier for these patients, be it by improving hand function, preserving mobility and strength, explaining medications and helping patients access them, helping individuals maintain weight, and cope emotionally with changes in physical capacity and appearance. Many answers won't come from old texts or even from research labs. The individuals with scleroderma, from their own long experience with the disease, are apt to offer coping strategies that may benefit many others. So listen to them, not only for their questions, but for their answers. Your own focus, concern, and professional training may put each of you in the position to create original solutions. When you do, we are happy to partner with you in researching and potentially implementing your ideas. Thank you.
And now it's my great pleasure to introduce our keynote speaker, Amy Gutzon.
First off, I'd just like to thank the Albany Pharmaceutical College and especially Peter and Linda of the Steffens Foundation for inviting me back here again. This is my third year to participate in this event. It's such an honor and a privilege to be here tonight with all of you and to be able to spend the evening talking about a disease that is just so near and dear to my heart for many reasons, and that disease is scleroderma. Scleroderma, it's a strange word if you really think about it. If you break it down, sclero meaning hard and derma meaning skin. The word literally means hard skin, which in layman terms is exactly what the disease is. I've heard some refer to scleroderma as the disease that turns your body to stone. All of these interpretations are frankly pretty spot on. Scleroderma is a disease that hardens the skin, the blood vessels, the joints, and in turn causes the body to stiffen almost like stone. When we think of this disease, we automatically think of the skin, probably because the name of the disease has skin in it. We tend to overlook just how intricate and complicated this disease really is, not only to diagnose and treat, but to manage and to live with daily. Scleroderma is a chronic autoimmune disease that can affect almost every part of the body, from your eyes to the bottoms of your toes. Treatment is complicated at best, but for survivors of this disease like myself, it is a necessary addition to my life. 18 years ago when I was diagnosed, I did what any normal person who is suddenly diagnosed with a weird, hard to pronounce disease. I went seeking answers and I started with Google. I found 2 sentences online about scleroderma and how it was treated. Those 2 sentences were, and I quote, "A chronic autoimmune disease that is terminal with no cure, life expectancy 10 years or less." That was it, those 2 sentences. And they were not very encouraging or educating, to say the least. I quickly realized that I wasn't going to have a ton of learning tools to help me navigate my way through this disease. And to be honest, for the first 5 years, I pretty much winged it. I found a mediocre doctor to treat me, and I just listened to him, and I did whatever he suggested, no questions asked. Now, why did I just fall in line and not question my care or my treatment, do you ask? The only answer to that I could come up with is because I was scared. I was young, I was only 19, I was terrified. I just wanted someone, anyone, to help me, to cure me, to make this go away. Slowly, over those 5 years, I realized that scleroderma was not just a disease that affected one side of the body or one organ. My symptoms included everything from my eyes being severely dry to my toes turning purple when I was cold. I soon realized that if my symptoms are multifaceted and affecting multiple organs, then I should probably require more than just one type of doctor. Look at it like this. If your eyes are bothering you, you go to an ophthalmologist, right? If you're having trouble with your heart, you go see a cardiologist. So if scleroderma was affecting not only my skin, my lungs, my heart, my esophagus, my eyes, even my teeth, well, maybe I needed to see and look into a team of doctors, and not just one doctor, singular, to treat all these serious symptoms. It took me 2 years of trial and error to find a coordinated team of doctors to treat my scleroderma as a whole. And that's with myself adding on a few extra helpers here and there, like a dentist, an eye doctor, a podiatrist, and hand surgeon. I began to take an active role in my health and treatment, and it made me feel secure and educated about the decisions that were being made about my body and my health. It gave me hope. Since deciding to take an active role in my medical treatment, I've overcome a lot. This disease, it's scary, it's overwhelming, it's life-changing. My body has undergone dozens of surgeries, some to correct symptoms from scleroderma, and some to prevent symptoms from scleroderma. But I have taken on a leadership role in each and every one of those procedures right alongside my coordinative care team, which has helped me learn how to live with this disease and not let it run my life. I've been living with this disease for the majority of my adult life, and I'm so thrilled to see that the way we are treating this disease now is to curate it to each individual based on their needs as a patient living with scleroderma, and not just the disease. As a patient, seeing all of you medical professionals here today gives me hope that as this disease ages in time, that patient care, awareness, and knowledge of treatment is not going to be forgotten, but in fact, it's going to be spread out, not just among doctors and surgeons, but nurses, pharmacists, physical therapists, social workers, like all of you. But that's not enough. We need a cure. How can we cure a disease that you've never even heard of? Awareness. I believe that awareness is the first step in the eventual cure of this disease. As you all sit here tonight, keep in mind that each of you have taken the first step. All of you have voluntarily accepted the responsibility of patient care for people with scleroderma. After tonight, you will be educated. And now you have a responsibility to help patients like myself and all of these patients sitting here to manage their illness the best way that you know how to. There may be times when you don't have all the answers, and trust me, it will happen. But that's okay. We as patients can help. I mean, we've been living with this disease, so we should know a lot about it, right? Honestly, I'd much rather hear you tell me you don't know than to give me some fly-by-night answer of some kind of treatment that you don't know works, or lie to me. The relationship we have with our care providers is important. It's tricky. It's intricate. It's intimate. It's emotional. It's everything. We need you. We need you to survive. We need all of you to be on the same page when it comes to our health. So please take this responsibility seriously, because my life and the lives of other patients, maybe sitting right next to you tonight, greatly depend on all of you sitting here and your commitment to fighting this disease with us and for us. Thank you.
Thank you very much. That was the perfect introduction. I would like to introduce the Director of Simulated Patient Education at Albany Medical Center, and Heather Friends. Will you please join us. And Heather's going to give us a few comments before we move into the interviewing period on the importance of active listening.
Amy's always an incredibly tough act to follow. Thank you. That was really fantastic and really summed up what I think the reasons that we're all here. So I am Heather Friends. I'm the Director of Simulated Patient Education at Albany Medical College. I am also a scleroderma patient. So that's one of the reasons that I became involved in this. And I'm just going to talk for just a couple of minutes about interprofessional education. The first thing that I want to say is that I stopped going to workshops on interprofessional education because everybody just talked about how hard it is to do, how difficult it is to schedule, and how chaotic it is. Well, guess what? It is. It's hard. You saw just trying to get everybody through the door it's a big deal, but we do it because it's important. The World Health Organization defines interprofessional education as two or more healthcare professionals coming together and learning about, with, and from one another. Okay, so that is the whole goal of this evening, to learn about, with, and from one another. A couple of hints while you're sitting around your table and you're talking to your patients. Thank you to every patient who got themselves out here tonight. It's a huge gift. You're supposed to be collaborating today, and Amy talked about the importance of that collaboration. I think all scleroderma patients understand that. You want to communicate respectfully with one another. You want to talk up the team. One of the things that I think you should practice today is explaining your role. Again, that's learning about, with, and from each other, but also realize that patients, when they are in a hospital setting or even in a clinic setting, they may not understand the role of everybody who walks through that door. So I think it's important to sort of talk with one another about what your roles are, because you may find out some things you didn't know about what pharmacists do or social workers do or whatever it may be. So talk amongst yourselves, but also get ready to introduce yourself to your patients so that they understand who you are. Working at a large teaching hospital, they may see medical students, residents, nursing students, whatever. So really get used to that. And talk up that team. Make sure that accurate information is shared between your team. Please take that out into your practice. If whatever isn't in the notes, the physician or the pharmacist that sees this patient next won't know. So make sure that's a big part of interprofessional education as well. And then elicit one another's perspectives, right? You're all coming from different strengths. So really elicit one another's perspectives. See what you can learn from one another today. And I encourage you, I've sat at the table as a patient, to talk amongst yourselves and help one another out. Don't feel like you can't just pass that baton and back and forth throughout the conversations. When it comes to interviewing skills, it's important, as we said, that you really listen actively. And don't be ready with your next question, right? We learn, when we're learning interviewing skills, we learn, okay, this is what I ask, and then this is what I ask next, and then this is what I ask next. And it gets in the way of us actually listening. So I encourage you to ask a lot of open-ended questions, and open-ended questions allows a patient to really tell their story, whereas a closed question asks for like a yes or no response. Really let your patients tell their story. But once they've told you something, follow up on that information so they know that you're listening and that you can carry that thread. So sort of follow your patients on their path. Doesn't mean you have to sometimes get them back onto your path. Ask about a patient's contextual features, their social history, what they do for fun, how does scleroderma impact that? Impact on life is a huge thing, not only with scleroderma patients, but with all patients. So finding out about impact on life can really help you make treatment decisions. And then finally, as you can see from Amy, scleroderma patients tend to be very health savvy. We see a lot of doctors. We have to learn a lot for ourselves. Elicit your patient's perspective. Ask them what they think might be going on, what they think might have changed in their life, all of those things. So, when we move to the interviewing, I want you to learn about, with, and from. Okay? Thanks. I'll see you at the end.